following podcast is brought to you by Kidney Stone Prevention Clinic of Orlando. Yes, thanks so much for everyone listening to the Crystal Clear Kidney Podcast with Dr. Paul Dreyer from the Orlando Kidney Stone Prevention Clinic. Dr. Paul also covers the entire state of Florida, just to let you know. So, Dr. Paul, welcome, and it's so good to see you again.
Yeah, Will, thank you for having me.
As everyone knows, this is a podcast that covers kidney health, your general health, how it pertains to the kidney, and also specific kidney health issues that you may be dealing with as well. Today, we'd like to welcome a special guest to the show. That is Dr. Paul's patient, Nick. Nick, welcome so much.
Thank you. Hello, everybody.
All right. So what we'd like to do is this. This is a story about Nick's trials and tribulations, and then about his outcome working with Dr. Paul. So, Nick, if you could take us back, give us the backstory of what you were going through some odd years ago, and then we'll work forward from there.
Okay. Well, I have had 9 kidney stones over the course of my life, from about 21 years old on. I'm about to turn 76 in September. 9 years ago, my wife and I retired from New Jersey and moved to Florida. And that's when I had my last kidney stone. And before we left New Jersey, a doctor of ours had told us that I should look up a nephrologist. And just to show how dumb I was, I didn't even know what a nephrologist was.
Most people don't.
Yeah, I've been dealing with urologists all my life, and not one of them ever mentioned that I should look up a nephrologist.
Nick, how many years total, before you met Dr. Paul?
On and off since I was 21.
So how many years total would you say?
55 years.
Wow, it's a long time.
Yeah.
Okay. All right. So to recap, made quite a bit of stones. It happened early on in life. You're working with a urologist, and then someone told you, hey, you might want to check out a nephrologist. And you probably said, what is that?
No, I said something like, yeah, sure. Okay, fine. Someday. And then we retired and moved to Florida. And that's when I had the last kidney stone. And it was pretty gigantic and super painful. And then I decided that possibly we should maybe consider what the doctor had said. So we looked around, we checked out everyone. And of course, we liked Dr. Paul's credentials, didn't know him yet, but we rang him up, and he had me come in. He did a urine analysis and did a urine test, a 24-hour urine test. And he had everything listed out, and he said, you're good here, you're good here, you're good here. Oh, your oxalates are way over here. So he said, there's medication for this. He said, but if you can stop eating foods high in oxalates, you might be able to get it under control that way. So he gave me a list of what to eat, what not to eat. I got on the program. I went back 6 months later, and he said, everything is fine. He said, if you continue living the way you're living, eating what you're eating, he said, you'll never have another kidney stone. And it's been 9 years now, and I feel great. We just had an ultrasound a short time ago. There's not even a tiny one forming, so everything works fine. He also told me that I can indulge in those things that I shouldn't be eating just by taking a certain supplement, calcium supplement, which I didn't understand at the time. You take more calcium for not producing any calcium, but obviously it works. And
Nick, you brought up a great point. So when you see Dr. Paul, right, it depends on everyone's lifestyle, but not only will Dr. Paul help you for not making stones again, right, take you out of pain forever. If you find out something is making stones and it's something you love to eat, Dr. Paul will, he will have a strategy for you to eat that once in a while and have something to counteract that. Dr. Paul, so when Nick came to you, so he's been producing stones for quite a few years. It is painful from time to time. So what tipped you off about Nick's condition?
Well, like Nick said, we performed the 24-hour urine collection, and his urine oxalate was high. Normal is less than 40. We strive for less than 40, and Nick was 67 milligrams in 24 hours. And in talking to him, he was at the time drinking smoothies and putting blueberries and things that he considered to be healthy, which in generally they are, but they had high oxalate content. And so once he moderated his diet and said, I'm going to get rid of those things that I'm eating that have high oxalate, his urine oxalate came down to 28. That's like,
is that a good score?
That's a good score
for the lay listener here.
Yeah, that's a birdie. So, and so like he says, what I told him was if your urine looks like this the rest of your life, Nick, you're not going to make any more stones. It's that high oxalate that was driving your stone production. So he's been on the straight and narrow ever since. And we even rechecked his urine not too long ago, and the oxalate was again like 29 or something. It was in the normal range. And so I said, you'll be fine. And as he said, we did imaging, and there's no stone recurrence at all that we can detect by imaging.
So Nick, getting back to you then. So how do you feel about finding Dr. Paul and his strategy compared to your doctors that you were working with before?
I can't understand why, no one had ever told me or given me that diet. I mean, it seems like such a simple thing. It was such a simple thing for me. I would imagine some people, might take a little longer or might have to do other things. But for me, it was such a simple thing. And I never, ever, for all those years, had someone give me the right information. So obviously, just the fact that I probably won't have another kidney stone for the rest of my life is like an elephant off my back. And, I give all the glory on that to the Lord and to Paul, Dr. Paul. Dr. Paul knows his stuff. He knows exactly where to go and exactly what to do. And it was seamless, easy, and it works.
Nick, that is awesome. So everyone, you can reach Dr. Paul at the Kidney Stone Prevention Clinic of Orlando. And Dr. Paul, what's your website they can reach you at?
www.kspfla.com. And Bill, I want to reiterate what Nick said. I mean, it's so tragic because it's not like he said, sometimes there's complicated patients, but I can still even tackle those and have success and keep them from having stones. But sometimes it is just one isolated thing. And it's not the same thing in everybody, but you pinpoint that one thing and you treat it and they stop making stones. And so anybody out there that's listening, please, give me a try, because you don't want to continue on the rest of your life indefinitely worried that you're going to pass a stone months or years down the road. I mean, this is treatable. So I'd encourage everybody to give me a shot. And I want you to be like Nick, where you're stone free the rest of your life and don't have to worry about that lightning bolt hitting you sometime down the road.
Right. Dr. Paul doesn't want to see you again as a patient, or very few, right? He treats, but his big advantage to the clients, you, the listener, is prevention. So this was a great patient success story. Dr. Paul, before we end this podcast, and we thank the viewers for listening, remember, this is a podcast about general health and also specific kidney conditions. Dr. Paul, for your diet, right? What liquids can we encourage people to take, and what liquids can we discourage people from using to prevent? Yeah. If you made a stone before, what's a smart way to move through this?
Well, water is always the safest, but you want 2.5 liters of pretty much any fluid. Stuff to avoid is anything with high fructose corn syrup for kidney stones and other health reasons. And for whatever reason, grapefruit juice. Those are the two that you want to avoid. But again, coffee's okay, water's okay, beer
Booze?
is okay,
Booze is okay.
So yes, in general. So again, that might have other
In
health
moderation,
considerations, but
yeah.
not for stones. So, but the key thing is taking an adequate fluid so that you don't have a very concentrated urine, and those elements in the urine that form stones are super saturated and then will precipitate out to make a stone in your urinary collecting system. That's what you want to avoid.
So listeners, there's hope out there for everyone. So give Dr. Paul a call. Well, everyone, thanks for listening, and we will see you on the next Crystal Clear Kidneys podcast with very valuable information. Once again, thanks for listening, and thanks, Nick, and thanks, Dr. Paul.
Yes, thanks, Will. Thank you, Nick. Appreciate
Thank
you.
you.
Thank you, Dr. Paul, for joining us. Once again, you can reach Dr. Paul with any questions at www.kspfla.com or at 239-221-1281, the Kidney Stone Prevention Clinic of Orlando. Until next time, folks.